show, Health and Wellness, Myths versus Facts. I'm Gargi Rao. This show is focused on understanding hormonal health. Endocrine glands produce and secrete hormones that are responsible for many important body functions. They play a vital role in the functioning of the body and determine if one develops diabetes, thyroid disease, growth disorders, and a host of other hormone-related disorders. How often does one consider or even track the health of one's adrenal glands when one is considering their health status? The sad fact is that adrenal health is largely overlooked. The role of the adrenal glands in the body is to release certain hormones directly into the bloodstream. Now, these hormones then determine how the body responds to stress, and some are vital for existence. Adrenal health needs to be given importance to ensure overall health, as it would help in avoiding various health complications and associated dysfunctions. We have an expert panel with us which will provide medically accurate and actionable advice to help prevent the development of adrenal disorders. We're joined by Professor and Dr. Jayabhanu Kanwar, Professor of Endocrinology, Department of Endocrinology and Metabolism, IMS and SUM Hospital, Bhubaneswar, Dr. A. Sharda, Consultant Endocrinologist, Samatvam, Indira Nagar Manipal Hospital in Bengaluru, and Dr. Vikram Singh Chauhan, Consultant Endocrinologist at Dr. Chauhan's Clinic and Jabalpur Hospital and Research Center, Jabalpur. Thank you so much, doctors, for joining us and shedding a light and awareness on this issue of hormonal health. Professor Kanwar, I'd like to start with you. And what happens when the adrenal glands don't function normally? What are some of the more common problems that are related to the adrenal glands?
Gargi, as you mentioned, the adrenal gland is an endocrine gland. It secretes various hormones, and adrenal cortex secretes three important hormones. It is steroid hormones, which we say is a stress hormone, and also it secretes mineralocorticoid hormone and some sex steroid hormone like adrenal androgen. If there is steroid hormone deficiency, the patient presents with weakness, fatigue, there can be nausea, vomiting, sometimes can be have abdominal pain, they have loss of appetite, there is lots of weight loss, and there is hyperpigmentation of the body. There is generalized hyperpigmentation. The whole skin of the body becomes darker. There can be localized hyperpigmentation like in the buccal mucosa, in the gum region. There can be hyperpigmentation in the nail beds, in the elbow or knuckle region. There can be hyperpigmentation in the areolar region. So these are the very common symptoms of adrenal insufficiency. They can have also low blood pressure. Blood sugar may also go down, so we say it's hypoglycemia. Sometimes we find the sodium levels are also low. But when there is mineralocorticoid hormone deficiency, there is volume contraction leading to dehydration. They can have salt craving. Occasionally also adrenal androgen can be also deficient. This is particularly marked in female patients who are present with loss of pubic and axillary hair. So these are common manifestations on how if the adrenal gland doesn't function properly.
All right. Dr. Sharda, what exactly is the Cushing syndrome or Cushing syndrome? If you could explain that to us.
Yeah. Cushing syndrome is due to excess production of cortisol hormone from the adrenal gland. Till now we discussed the deficiency. Now we are discussing the cortisol excess. Now, while cortisol is very essential for normal functioning of the body, but the excess of this cortisol hormone from the adrenal gland can lead to multiple medical problems in the person, like weight gain, especially around the abdomen, called central obesity. It can cause muscle weakness. It can cause high blood pressure and also cause weak bones, osteoporosis, and very thin skin. And this is generally due to overproduction of cortisol hormone itself due to a tumor of the adrenal gland, or it may be due to excess production of the cortisol stimulating hormone like ACTH from a small organ gland at the base of our brain called pituitary, or from other organs of the body, the ACTH can come. This stimulates the excess cortisol production from the adrenal gland.
All right. And now, Dr. Chauhan, taking that forward, how widespread is Cushing syndrome among Indians, and its prevalence similar in men and women?
So, when we talk about Cushing syndrome, endogenous Cushing syndrome is the type where the syndrome has occurred as a result of cortisol excess produced within the body. And this is a rare, serious disorder, and it occurs at about a rate of 2 to 3 individuals per million population per year. And as far as gender discrepancy is concerned, it occurs around, it occurs 3 to 4 times more commonly in women than in men. Now, this is to be distinguished from exogenous Cushing syndrome, which is the more common variant, which is caused by an excess, which is caused by glucocorticoid drugs taken by the patient either for a legitimate medical reason or taken illicitly, as is often the case. Now, prevalence patterns for this are difficult to estimate because there are too many variables involved, and this issue will usually get resolved once the offending drug is discontinued.
All right, Dr. Kanwar, what are the symptoms that can help alert a person that he or she has this syndrome, Cushing syndrome?
Yeah, Dr. Sarda has already alluded it, but I would say if somebody is gaining weight and becoming obese, there is a typical kind of obesity in Cushing syndrome. It's called central obesity. There is fat deposition over face, trunk and abdominal region, and relatively sparing the extremities. And if the fat gets deposited on face, we say it's mooning of face. If sometimes fat gets deposited on the upper part of the neck, then we say it's a buffalo hump type of fat deposition. And the typical features of Cushing syndromes are like stria. These are the stretch marks which normally see in pregnancy or somebody is gaining weight. But the Cushing syndrome stretch mark or stria are different from those seen in the pregnancy. These are Cushing syndrome. These stretch marks are red and purple color. These are wider. The thickness is more than about 1 to 2 centimeter. They have some petechial patches on the skin, like the petechial patches mean red blood patches over the skin. They can have multiple skin infections, fungal skin infection. And they can have bone pain and proximal muscle weakness. That means the patient is not able to get up from the sitting position. They find it very difficult to get up from the sitting position. And in female particularly, they have increased acne or increased facial hair growth. They can have menstrual dysfunction like oligoamenorrhea or amenorrhea. So they can have multiple metabolic disorders like diabetes, hypertension, as well as renal stone. So if somebody is having specifically central obesity, proximal muscle weakness, petechial patches, the typical stria of Cushing syndrome, then we should evaluate that patient for the Cushing syndrome.
All right, Dr. Sharda, how is a Cushing syndrome then diagnosed, and which are the kind of tests used to diagnose Cushing syndrome?
Once Cushing syndrome is suspected, it is quite easily diagnosed with tests conducted in the blood, saliva or the urine. A careful history and a detailed examination is done by the doctor to see whether the patient has Cushing syndrome. Then we can do a blood test at 8 o'clock in the morning called serum cortisol after giving a particular tablet the previous night at around 11 p.m. We can also do a test in the saliva, which is called late night salivary test between 11 p.m. and 12 midnight. And we can also perform a 24-hour urine collection in which the urinary free cortisol is tested. Now, once the presence of excess cortisol is established through one of or multiple tests which we have done above, then we need to do further tests to figure out the cause of this excess cortisol in the body. And these include further blood tests like plasma ACTH levels, etc. and imaging tests like CT scan of the adrenal gland to look for the adrenal tumor and MRI of the pituitary gland to look for the pituitary tumor, etc.
All right, Dr. Chauhan, is Cushing syndrome, if you could tell us, is it a serious medical condition, and can it be completely cured, or is it something that one has to manage lifelong with medications?
So, Cushing syndrome is certainly a serious medical condition. It gives rise to diabetes, mellitus, it gives rise to hypertension, tends to weaken the bone, as previously mentioned by my co-panelists. It causes a condition known as osteoporosis, tends to cause a flare-up of serious infections in the body, tends to push the body towards cardiovascular disease, and will lead to an early mortality if not taken care of properly. So yes, it is a serious condition, and it should be managed when diagnosed appropriately. The ideal treatment for Cushing syndrome would be surgical removal. Would be first to isolate the cause of the syndrome properly, and then remove the cause surgically. So that would be the ideal treatment for Cushing syndrome. Unfortunately, that is not always possible. In which case we might need to resort to medical management, which is almost always a temporary stopgap solution. It can be used preoperatively. It can be used when the condition is causing too many serious symptoms, and we have not been able to isolate the actual cause, and so that the medical management will be temporary. And this is because medical management is not very effective, and it is also associated with a number of adverse effects. Rarely you might need to use radiotherapy also, for example, in a tumor which has been excised but there is some remnant remaining, and therefore that might need to be managed with radiation as well. But the ideal treatment for Cushing syndrome would be surgical.
All right, and Professor Kanwar, we just discussed, the medical treatment for Cushing syndrome, but what are some of the other issues that could cause problems in the future with Cushing syndrome?
If Cushing syndrome is not treated properly, if the cortisol doesn't become normal, in the future it can develop into cardiovascular disease like myocardial infarction, stroke, thromboembolism, particularly as my co-panelists say that they are associated with hypertension and diabetes. In those patients, there is increased risk of this cardiovascular disease, and there can be increased risk of osteoporosis leading to fracture, vertebral fracture, refracture. They are more susceptible for infection. Even if the hypercortisolism is higher, there can be a rupture of the bowel. So these are very fatal conditions. If you do not treat properly in time, they can lead to death in about 5 to 10 years of time.
All right, so that's a lot of questions around this Cushing syndrome. We'll slip into a short break and return with more. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we are focusing on understanding hormonal health and how it affects our overall health. And we have a panel of doctors answering all our questions. Dr. Sharda, we were talking about Cushing syndrome, and let's discuss that further. Can Cushing syndrome affect future pregnancies?
Now, the thing about pregnancy is it is difficult for women with Cushing syndrome to become pregnant because we have discussed the symptoms earlier. It can cause irregular menstrual cycles or absent periods, and also cause hirsutism, which is excess facial hair, acne, all hormonal imbalances, and hence the women may be actually seeking fertility treatment for pregnancy. And sometimes the doctor can actually pick up and screen for Cushing syndrome in such patients with excess facial hair, rounding of the face, and central obesity, along with irregular periods or difficulty in conceiving. Having said that, the Cushing syndrome is rare during pregnancy, and when it occurs, it is usually due to an adrenal tumor producing excess cortisol. Now, excess cortisol by itself does not cross the placenta and harm the baby directly, but excess cortisol does lead to placental dysfunction, and hence the baby or the fetus may be small, and also there can be a premature birth and miscarriages. And there are some maternal health issues due to excess cortisol, especially during pregnancy, because even in non-pregnant people, Cushing syndrome can lead to high blood pressure and high sugar levels, and the same happens during pregnancy also due to excess cortisol. So the high blood sugar and high blood pressure again can cause deleterious effects on the pregnancy in the form of premature birth, small baby, and also lot of miscarriages. But if the diagnosis of Cushing syndrome is established during pregnancy, or a patient with Cushing syndrome does get pregnant, this can be safely treated in the hands of the expert with a surgery by removing the tumor and not affecting the pregnancy in the care of the experts in the field.
All right. Now, Dr. Chauhan, why do patients with this Cushing syndrome then gain weight, and is it possible for them to lose this newly gained weight?
So, weight gain is a feature of Cushing syndrome, and it occurs because of the effect of excess cortisol at the level of the brain, which stimulates the feeding center. So the patient has a greater appetite, tends to eat more. There is also associated fluid retention with the syndrome, and that tends to cause weight gain also. Then there is the problem of the body forming excess of adipocytes or the fat cells. So that process of adipogenesis, fat cell formation, is increased, and that tends to cause weight gain. And finally, patients with Cushing's tend to exercise less, and this is as a result of the muscle weakness, which is characteristic of the syndrome, and also coexisting depression, which is often present. So these are the reasons why weight gain occurs in Cushing syndrome. There is also a possibility of weight loss occurring in Cushing syndrome, which is less common, and weight loss with coexisting Cushing's may occur if the cause of the Cushing syndrome happens to be a cancer, for example, an adrenal cancer or a small cell lung cancer, and that cancerous process will lead to weight loss. Additionally, they might be uncontrolled diabetes mellitus or an uncontrolled serious infection such as tuberculosis, and that might cause weight loss as well.
All right. Professor Kanwar, is Cushing's disease worse at night?
To know that, we need to understand the diurnal secretion of the cortisol hormone. The cortisol hormone levels are higher in the early morning, and by evening and night, the cortisol hormone goes down. However, this occurs in a normal person, but in Cushing syndrome, this diurnal secretion pattern is lost. So at night, the cortisol hormone levels are higher in Cushing syndrome patients. However, if you look at the clinical manifestation, it doesn't differ from day to night time. It overall remains same.
Right. Dr. Sharda, can you reverse Cushing syndrome?
Yes. If the source of excess cortisol in the body can be completely successfully removed, then the Cushing syndrome can be reversed. For example, there is an adenoma secreting the excess cortisol, or there is a pituitary tumor which is secreting excess cortisol stimulating hormone. If these are successfully completely removed and the source of excess cortisol is eliminated, it can be reversed. Sometimes the cortisol stimulating hormone is in other organs of the body, and that also, if it can be successfully removed, then we can reverse the Cushing syndrome. But sometimes, as was earlier mentioned, the patients do need additional treatment with radiotherapy and medical therapy. Once it is completely eliminated, the source of excess cortisol, the symptoms of Cushing completely come down by about 12 months. Even the weak bones will come down, become stronger in about a few years. But the high sugar, diabetes, and the high blood pressure sometimes do not completely reverse, although the Cushing syndrome is completely treated. Hence, they may require further regular medication.
All right, Dr. Chauhan, now let's talk about treatments again, and what surgical treatment is indicated for adrenal gland in the endogenous Cushing syndrome?
Right. So if the cause of the Cushing syndrome is an adrenal adenoma, a tumor of the adrenal gland which is responsible for the syndrome, then the treatment would be a removal of the affected adrenal gland, preferably by a laparoscopic approach, and in select cases by an open approach, and that would be curative for the individual. There might also be a requirement of removing both adrenal glands. This is less commonly done, so a bilateral adrenalectomy, as it is known, and this might be required in the event that the patient continues to have severe manifestations of the syndrome, and the source of the tumor has not been properly identified, or if the patient continues to have severe symptoms in spite of a prior surgical procedure, and this is also required in the twin very rare conditions of both the adrenal glands producing excess cortisol in an autonomous manner. So that is when this less commonly used approach of removing both the adrenal glands would be required, and following the bilateral adrenalectomy, the patient would be required to be on a lifetime replacement of hormone secreted by the adrenal gland.
All right. Well, thank you so much, doctors, for joining us and, shedding light on these issues that can take place because of our hormonal imbalance or hormonal issues. Thank you all for watching at home. Goodbye.